Warfarin, also known by the trade name Coumadin. Warfarin is indicated for the treatment of venous thrombosis, pulmonary embolism, atrial fibrillation, and myocardial infarction. Warfarin works by disrupting liver synthesis of vitamin K-dependent clotting factors. The therapeutic classification of warfarin is an anticoagulant, and the pharmacologic class is a coumarin. Special considerations for nursing include a contraindication in those with active bleeding or severe hypertension, that warfarin can cause or worsen bleeding, and that aspirin and NSAIDs can increase the risk of bleeding. Azole antifungals, as well as cimetadine, can increase the effects and levels of warfarin, and many supplements and herbal medications can also increase the effects of warfarin. Therefore, a full history should be taken. Large amounts of vitamin K can antagonize the effects of warfarin. Signs of bleeding should be constantly assessed for, and patients should be instructed to report any signs of bleeding, including bleeding noses, very large and unending bruises, or severe bleeding of the gums during toothbrushing. Patients should also not drink alcohol while on warfarin, as this can increase bleeding risks. Bleeding times should be monitored frequently, and target INR levels should be between 2 and 3 for most patients, or higher at 2.5 to 3.5 in those with mechanical heart valves. In the case of overdoses, or INR levels being too high, vitamin K is the antidote for warfarin. However, vitamin K antagonism takes a long time to have an effect. Therefore, in acutely bleeding patients, fresh frozen plasma, or FFP, as well as factor complexes such as factor 7 and factor 8, should be used alongside blood transfusions to manage the patient's bleed. Warfarin also has an interesting story behind its name, whereas the WARF in warfarin stands for the Wisconsin Alumni Research Foundation, which funded the initial discovery of warfarin, and the latter half, ARIN, simply stands for it being a coumarin drug.
This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.